Medicaid is getting name-checked a lot lately.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes.
But President Donald Trump has said otherwise.
We're going to love and cherish Social Security, Medicare, Medicaid. We're not going to do anything with that.
But what exactly is it? Here's what you need to know. First off, it's not Medicare, though both were signed into law at the same time by President Lyndon B. Johnson in 1965. Medicaid offers services primarily to people with low incomes and disabilities. Medicare is mostly for people 65 and older. Medicaid is integral to the U.S. healthcare system. It keeps hospitals and other providers afloat, provides a key source of federal funds to states, and helps provide health insurance to people who couldn't otherwise afford it. More than 79 million people in the U.S. receive services from Medicaid or the closely related Children's Health Insurance Program, or CHIP. About 40% of all children in the country are covered by Medicaid or CHIP. Both programs pay for services like routine checkups and vaccinations, hospital stays, and more. Medicaid covers pregnant people before and after birth and more than 40% of all births. Medicaid also pays for many nursing and home health services. You might be on Medicaid and not even know it. Medicaid programs go by many different names, in part because states use private insurance companies to run them. In Wisconsin, you might have Badger Care Plus. In Connecticut, Husky Health. In Texas, Star. The Affordable Care Act vastly expanded who qualifies for Medicaid by income. This is what's known as Medicaid expansion. Currently, the median eligibility level is about $21,600. That's for a single-person household with no dependent child. Expanding Medicaid came with a big incentive for states. The federal government would pitch in more money per enrollee to help cover them. The focus was on Americans without employer-based insurance. The goal was to cover people with the very lowest incomes, and as their incomes rose, they could move to subsidized health plans sold through the ACA's exchanges. At first, that expansion was mandatory, but in 2012, the U.S. Supreme Court made expansion optional for states. Most states decided to expand anyway. That includes ones led by Democrats and Republicans. In the 10 states that haven't expanded Medicaid to more low-income adults, the median eligibility level is just under $6,000 a year for a single-person household. That's created this thing called the coverage gap. In those 10 states, adults can make too much money to qualify for Medicaid, but not enough money to get help paying for ACA insurance plans, leaving some unable to afford coverage. In 2023, spending on Medicaid reached $880 billion, with about 70% of that coming from the federal government. States chipped in the rest. Federal dollars cannot be used to offer Medicaid coverage to immigrants living in the U.S. without legal permission, but some states have used their own funds to extend it to them. It's not clear what's going to happen to Medicaid, but Republicans in Washington are again pushing for major changes. At the heart of that debate are some big questions. How big should the U.S. medical insurance safety net be? And who deserves that government assistance?